Hello everyone, I am Dr. Arun Reddy, Consultant Neurosurgeon and Endoscopic Spine Surgeon at Care Hospitals, Hyderabad. Today we are going to talk about low back pain, which has been a perennial problem in our urban as well as rural society. So people who suffer from the pain in their lower back, this is called low back pain. It is categorized into acute low back pain as well as chronic. If the back pain exceeds more than 12 weeks, then it is called chronic low back pain. So let us briefly know about what are the risk factors and what are the causations, and let us discuss in detail about the preventive aspects of the low back pain. That is the spinal health that I want to talk about. So let me know about the risk factors which lead to low back pain. Most important thing is age. As age progresses by, the hydration of the intervertebral discs as well as the bone health gradually degenerates, which leads to the back pain. So people more than 30 years, they should take care of their back so that with the age process their bone as well as disc health is maintained in a good way. Second is their weight. Weight is one of the important aspects. Belly weight puts on a lot of strain on the back, so we have to make sure that we have a healthy weight pertinent to our body. And the third thing is sedentary lifestyle or our working pattern. Sedentary lifestyle, again, it is one of the risk factors for low back pain, and our working patterns, especially the people who are there in corporates as well as in software professionals, they don't take care of their back ergonomics properly, wherein the back care is not taken care properly, which should be taken care. Again, they are prone for the low back aches. Fourth is people who suffer from the infections as well as other diseases which are pertinent to the lower back in the spine, which leads to low back pain. This should also be kept in mind. Anxiety as well as depression, it also puts a lot of strain on the back, which leads to low back pain. Sometimes gallbladder stones as well as renal stones, they are also depicted in the form of low back ache, which leads to the issues. So let us briefly understand what are the causes for the low back pain. The most important cause for the low back pain is the muscle pain or the muscle spasm which the person suffers through. Second is injuries pertinent to the spine or muscle, which again leads to low back pain, or the changes in the bonic vault of the spinal canal, which leads to back pain. Disc related issues, or the nerve compression due to the disc related issue or due to the bony vault causing compression in the nerve, or the slippage of the bones in the lower back. These lead to back pain. Other than this, again, diseases which are pertinent to the lower back in the form of cancer or infection or a renal or gallbladder stone causes low back pain. Now I am going to talk in detail about the preventive aspect of the low back pain, which we usually ignore and don't follow. So let me talk in detail. So three important things that we need to always follow. We need to avoid lifting heavy weights. What do you mean by heavy weights? Lifting more than 8 kilos with two hands. That is considered a heavy weight. So try to avoid lifting heavy weights as much as possible. Do not bend forward more than 40 degrees, so which causes strain on your back. And do not sit down, because on sitting down and from getting up from sitting posture, there will be a lot of strain on our back, which leads to back pain. So these three things are most important thing. And the fourth thing is how should we sit on a chair? The best chair is a plastic chair which we usually have at our home. That's the best chair actually, because we can sit properly with our back totally entirely rested on the back of the chair, as well as our foot always touches the ground at 90 or 110 degrees. That's how we need to sit. Okay. The maximum sitting time, if you are a software professional, is around 30 minutes in front of a monitor. And always make sure the under table of the of your table is always empty, so that you can slide your chair and tuck under the table, so that your hands would be always parked on the table, so that your neck, your shoulders and your back is always supported. This is how you need to sit. And as I told, max sitting time is around 30 minutes. Cross by 30 minutes, just be off the system. Gently stretch your neck on the sides as well as front and back, and stretch your back behind as well as forward, and go back to work. This should be a regular rhythm. Every 30 to 40 minutes, do take breaks. And the third important thing is how longer should we stand? 30 minutes is usually recommended for a person who continuously stands. After 30 minutes, let him sit for a couple of minutes properly again, stand. Okay, and if you consider in a household phenomenon, people do talk that we need to lie down on a hard mattress or lie down on a floor which is hard, and don't sleep on a soft mattress and all. No, that is not how it should be. You always should make sure that you always sleep on a cot, never sleep down, because once you sleep and try to get up, there will be strain on your back. So sleep on a cot, and if you think this is your cot, make sure you always sleep on a side, then you turn to become straight. And whenever you get up, you turn to a side and get up. This is how a person should sleep, and he should get up from a bed. And any mattress is a good mattress, provided it should not be too soft and it should not be rocky hard. Now all the standard companies, they provide good cushioned mattress, especially the memory foam, along with coir. That is the perfect mattress. Okay, and whenever in the daily routine too, try to have shower bath. Do not bend forward to fetch mug of water while having bath. Western toilets are the perfect toilets rather than an Indian toilet. So bring all these things into your rhythm. And the most important thing is what food do we need to take to have a healthy back. Glass of milk and couple of egg whites every day, which have got good amount of calcium. If you're a vegetarian, go to the vegetarian food which have got a lot of calcium, that is tomatoes or potatoes and green leafy vegetables. Third thing is daily walk at least for 15 to 20 minutes in sun. That is sufficient to maintain the tone in the body as well as give you good amount of vitamin D. And if you are a non-vegetarian, weekly once or twice, you need to have chicken or fish, which is good in vitamin B12. Calcium, D and vitamin B12, they are good for spine health. So take all this into your dietary thing as well as into your daily routine, so that you will maintain a good healthy lifestyle for your back. So take care of your back so that the back takes care of you. Thank you everyone.